Yes, indeed, it's World Cancer Day, and joining us to discuss that, Senator Lanre Tejosho, who is the chair of the Legislative Initiative for Sustainable Development. He's also CCFN Campaign Global Ambassador. Good morning, Senator. Thank you for joining us this morning on the program. Well, it turns out, it turns out that more often than not, it's days like this, the World Cancer Day, that attention really turns on cases such as this. Because, I mean, looking through several articles, we see that cancer is the second leading cause of death globally. And even today's dailies are reporting that, look, there's been a huge jump, even right here in Africa. Look at that. WHO raising that concern in Africa that 338,000 cases in 2002, and now 846,000 in 2020. That's a huge leap. Well, tell us about how you even got into CCFN and what your work is now.
Well, CCFN is Cervical Cancer Free Nigeria initiative, started by some professors, some cancer oncologists in the United States, Stanford University, Harvard, and also University of California. They invited three of us to be global ambassadors, myself, the president of the stock exchange, Mr. Ogubanjo, and the first lady of KEBI, Dr. Shinkafi Bagudu, because all these diseases, especially cancer, we need a lot of advocacy. We need to be talking about it daily, and because with prevention, we can prevent all these huge numbers of casualties that we are having. So really, we are focusing more on cervical cancer because it could be prevented by giving vaccines to our young girls between the ages of 9 to 13. And the more we educate them on vaccines concerning this particular cervical cancer, they will know the importance and they will endeavor to seek the vaccinations. Unfortunately, the pandemic now is kind of clouding all other diseases, but we have more casualties with cervical cancer, even more than COVID today.
Well, the report is indicating that 28 people die every day as a result of this cervical cancer. But before COVID hit, what kind of progress was CCFN making in drawing awareness and ensuring that that figure is reduced to the barest minimum?
Well, CCFN is actually just about to take off in a larger version. Before now, we were using the media initiatives like the comics, giving the children stories that will let them know the history of cervical cancer, to know the basic things on how to prevent cervical cancer. There was some advocacy done in Lagos State and Rivers State a few months back with the primary school students. We gave them a lot of comics with these stories. We made it comics because it will be easier for them to read, and also it will be more interesting for them, and they will take it more serious to get the messages across. So far, that's what we've done. But now we want to escalate that to other states and to ensure that education on cervical cancer and prevention is the major message.
I don't know how far-reaching that education will be and how significant that can be, especially in pulling down the numbers, because as you very well know, and from the figures that are available, 200 deaths are attributed to cancer generally in Nigeria every day, and cervical cancer is the second on the list of all kinds of cancers that cause people's deaths in Nigeria. So I'm wondering, first of all, that level of awareness, what is making it difficult to get it across to people? One would also want to know if the impact of what this whole thing is even getting to is real to the people who are affected by these things. So let's begin with how far-reaching do you see the awareness and the education about cervical cancer to people generally?
Well, first of all, because of the geographical situation of the country and the landscape that is so huge, to get to more than 100 million people all over the country, we need very strategic logistics put in place. We have all our wards, more than 10,000 wards in the country. If we have a functional primary health care system, we should be able to have primary health centers that are within walking distance to every Nigerian. At that center, we should have trained nurses or community health workers that will be able to continue the education whenever the patients come into the health center for even other diseases like malaria and so on. So we just need to get our primary health centers functional, first of all, which is what we are drumming to our colleagues in the parliament in terms of funding of our primary health centers for them to be more functional. So that will be the real ultimate vehicle to get the information across to Nigerians all over the country. Primary health center, its functionality is key.
Okay, but Senator, what kind of success has been recorded? Because even globally too, funding for cancer generally has just nosedived. So are you succeeding in convincing your peers to ensure they improve funding for this purpose?
Well, first of all, the treatment of cancer is very expensive. And because of that, when I was the chairman Senate Committee on Health, in concert with the minister at that time, Professor Adewale, we ensured that we introduced into the budget what we call catastrophic funding. That is to be able to subsidize the treatment for poor Nigerians for cancer. And I believe even the budget for this year, there is also allocation for that catastrophic funding. So I believe with more funding in that particular budget line, we should be able to at least start making a difference in terms of the treatment for cancer. So also we have the Basic Healthcare Provision Fund, which is 1% of our consolidated revenue fund. That was introduced about 3 years ago when I was there. With that funding also, we should be able to have more capacity to provide the commodities needed in the primary health centers for them to be able to look after patients that come in for the symptoms relating to cancer. So I believe funding, yes, that's what we should ensure that we take care of. And of course, how we ensure that there's transparency and reduce corruption is also a key factor.
Well, Senator, I don't know, people listening to you now will be wondering how really significant all of these things that you have talked about has been. 200 deaths every single day of Nigerians. It definitely is something that should make anyone feel very, very bad. And from the recommendations, from the figures available to us through the WHO, it is clear that if we do not expedite action on some of these issues that you have raised, the numbers can only grow and things can only get worse. You have also established the fact that we have a very serious logistic problem in being able to move all of these facilities around, and given the large-scale insecurity that we have on our hands and the sparse, very, very wide, ungoverned spaces all over the place. From where you sit as a legislator and someone in government right now, what do you think can be done to, as quickly as possible, reduce these figures? Because you know that the emotional impact on the people who are directly or indirectly affected by the impact of cervical cancer in particular is really something that we can't even begin to quantify. So how significantly do you see us doing anything as quickly as possible to take these numbers down?
First of all, I'm not in government right now. I left the Senate July 2019, but I'm still in contact with my colleagues. If you see the kind of beautiful intervention we are having for the COVID pandemic now, introduction of the presidential task force. I mean, every day we talk about the pandemic. Meanwhile, the pandemic is not taking away the lives of more people than cervical cancer. So I believe the government needs to give equal attention to all the different diseases in the country, because the PTF is doing a good job now in terms of awareness of what we should be doing concerning the COVID-19. So it is a good platform for them to now use the same for all other diseases killing all our people all over the country. So I believe that's a good way to start.
Well, we've since been joined by Dr. Zainab Shinkafi Bagudu, who is also a CCFN Global Campaign Ambassador. But she is the founder and CEO of Medicaid Cancer Foundation. She joins us as well via Zoom. Good morning, and thank you for joining us today on the program from KB. Well, if you just give us an idea of what's going through your mind about this in terms of where we are with respect to addressing this challenge.
Good morning, and I wish us all a successful World Cancer Day, the 4th of February. We are doing well. We're not in the promised land yet, but in terms of so many things, we're not doing too badly. When I started this advocacy 12 years ago, we didn't have a national cancer control plan, which means we didn't have any idea of what we were going to do on paper. And for us to have meaningful progress, it needs to be planned properly. Today, we have one. There was a time when the most common thing you would hear in the press is Nigeria has no radiotherapy machine. Nigeria has 7 dead radiotherapy machines. Today, we have quite a number. It's not as much as we would like or as many as we would like it to be, but we do have those radiotherapy machines working in reasonably good condition, particularly by the government in Abuja and in Lagos. So these are advances. There's a health fund for indigent cancer patients, which the distinguished senator was one of the key people to ensuring is appropriated into the Nigerian budget. For the first time in 2020, it was appropriated, and we know that these monies have been distributed across to the pioneer teaching hospitals where they can reach cancer patients. There's a lot of movement in the civil society space, organizations like the Medicaid Cancer Foundation, like the Cervical Cancer Free Campaign of Nigeria, First Ladies Against Cancer, are all creating awareness, helping to screen, and assisting patients to fund their treatments in various degrees. So I think we have come a long way. We can do better. The people are more aware. People talk about it. The fact that we're here talking about it, I hate to say that probably a couple of years ago, channels would not be having a program on the 4th of February, but the conversation is high and we're doing a lot more. Science has advanced. We have things like the HPV vaccine that is available to give to young girls that will protect against having cervical cancer in the future. Unfortunately, yes, there has been a drastic setback. The year 2020 saw an unprecedented interruption of all our health programs through the COVID-19 pandemic. And of course, this affected cancer patients a lot. Cancer is an underlying disease, and so we have to be more aware and careful when we treat them. Radiotherapy was stopped, chemotherapy was stopped, and patients suffered. And I would like to say in the next 10 years, we're going to see an increase in the number of deaths that we had due to the COVID-19 pandemic, apart from the obvious fact that resources had to be diverted there. But of course, one positive part of the COVID pandemic I like to talk about is the fact that it has pushed us to our extreme limits. It has helped us to be more adventurous, to be more daring, to set up better hospitals, to create a vaccine. When I say us, I'm not talking about just Africa and Nigeria, but the entire world has come together to react to this pandemic. And the ultimate beneficiary of all this is the health system.
Well, Dr. Bagudu, maybe not 10 years, in fact, 20 years now. Channels Television for over 20 years has continued to follow issues such as this. So, I mean, I could show you the archives if you want to. But, I mean, talking about this cervical cancer, the effect of COVID-19, and, I mean, the theme for this year's Awareness Day, which is I Am and I Will. It talks about everybody taking action. But, I mean, people will get awareness, yes. People will hear about it. I even hear that there are comics for children just to send the message to them. But when the rubber hits the road, I mean, nobody prays to get cancer. But when that happens, or if that happens, there's questions about access to treatment. And I'd like to touch on this because this is a very important part also. I mean, getting access to treatment. I mean, a lot of insurances don't cover treatment for cervical cancer and cancer generally. There's also, you know, very few public hospitals or facilities that treat cancer free of charge. And we're talking about thousands of people who have cancer. So what is the conversation around that?
Is that me as well?
Yes, that's for you, Dr. Bagudu.
Okay. Yes, definitely. Like I said, access to treatment is a huge problem in terms of having the resources. I don't know of any place that you can go that you will get free cancer treatment. I was one of the key persons that advocated for the National Health Insurance Scheme of Nigeria to include cancer care, starting from screening to diagnosis to treatment in its program. And so now cancer patients in Nigeria that have the NHIS cover are able to get some degree of support from the NHIS, but it is not completely and totally free. So that is a big problem, even where the infrastructure, the hospital, or the machines exist. Affordability is a problem, and that is why civil society and corporate bodies come together to raise funds from various methods, fundraising activities, high net worth donations, and just donating services to be able to support these patients. Today, we're launching the Orange Box, my foundation, the Medicaid Cancer Foundation, and we'll be disbursing the sum of 200,000 naira to 20 cancer patients, as well as other necessities that help to improve their quality of life. That is our main activity for this year's World Cancer Day. We're not alone. So many other civil societies will be doing one thing or the other, depending on how much they can afford or they have been able to raise. Like I said, it's been a tough year with the COVID, but still bodies are helping and doing a lot. So it's not easy. It's not how we would want it to be. And that's why we have to continue to push more to ensure that our facilities are improved, the right equipment are brought into the country and it's given at a lower cost. Right now, a cost of radiotherapy in the National Hospital Abuja costs about 600,000 naira. For us, at least a patient will need 6 to 12 courses for stage 2 carcinoma of the breast, for instance. So you can imagine how much even the well-to-do gets affected by cancer. So we do need to do a lot more in terms of funds.
Well, madam, these figures, I'm pretty sure they are not lost on you. Globacon fact sheet says an estimated 116,000 Nigerians had cancer, with more than 70,000 deaths in 2018. And if you also look at this one from the WHO, it says between 30% and 50% of cancer deaths could be prevented by modifying or avoiding key risk factors. As I said, I'm pretty sure these facts are not lost on you. Now, with these facts known, and what you have talked about, the cost of getting these facilities, this service to people, would you say that government is giving enough attention to this very, very deadly disease affecting so many people and killing so many people over the years?
As an advocate, I'd like to say no. However, as the spouse of a state governor, I'd like to say yes. The burden of governance is high. It's a lot. Government, I do cancer advocacy. I've done it for 12 years. But I come across a lot of resistance in the States when people believe that why are we doing things that have to do with cancer? Why are we having awareness programs? Why are we using our money to screen patients for cancer when malaria is killing our people, when hunger is killing our people? This is the kind of reaction that I get. But I have been dogged and rigid about it, and I don't divert from my course and belief and passion. And we have been doing it for over 12 years. So the government has to consider the various issues, not just in health, education, provision of infrastructure, agriculture, so many other things, and the resources have to be spread across. But we can do more. We can always do more. And I don't believe that we should always leave it to government. And I commend you for doing cancer advocacy for the past 20 years. It helps because the one thing that we can do to help our people is to try to improve the thought process and to detect such diseases like cancer earlier. The earlier we're able to detect it, the easier it will be to treat and the more successful. These figures you're reading out, it's not the same when you look at it per population in the high-income countries. And the only difference, well, there are two differences between us. That is screening methods. Once a woman hits the age of 50, she gets a letter, a phone call, constantly asking her to come in for screening, so that at the very early stage, if there is that cancer in her body, the treatment will be started, whether it is in, and then it brings us to the next issue, which is access to treatment. Everybody in their environment or in their area and community has got a cancer center that they can go to that offers different modalities of treatments. That is in the westernized countries. But for us here, you find a woman that lives in Kebbi has to travel down to either Abuja or Ibadan or Lagos. And sometimes the machine here is not working, that one is down. But thankfully, like I said, those kind of stories are reducing. Even if we have just 4 centers, these 4 centers are adequately equipped now with modern equipment, state of the art.
You know, it's quite interesting when you replied yes and no to that, but it's understandable. Now, it's a very tricky period we're in because there's COVID-19, of course, and I'm sure you've been following the conversation around vaccines for COVID-19. For cervical cancer as well, I mean, it's vaccine preventable, the HPV vaccine. So how well have people been able to buy into getting vaccines, seeing that for COVID-19, there seems to be a huge challenge to get people to buy into it. So are you also facing that challenge? Has COVID-19 compounded it? Or really, what are the projections really for you?
When I see the debate over the COVID vaccine, I have a little smirk in my heart because this is something that we in the cancer space have been facing for years. The HPV vaccine against cervical cancer has been available, but it's been available for at least 10 years now, but it is not widely available in low middle income countries due to various reasons like cost, due to our health system not being interested, our health system can't afford it, and the availability, vaccine production is much slower than the demand globally. There are bodies like Gavi, the Vaccine Alliance, that have been helping low middle income countries to access the vaccine. But Nigeria is always in this peculiar situation of where in the middle and not classified as a poor country at the same time, so we cannot access the full aid. At the same time, we're not rich enough to afford these vaccines for our girls. Like I said, the HPV vaccine is a vaccination that can be given to girls from the age of 15, at the age of 15, from 8 to 15. But it's not on the Nigerian routine immunization schedule by the National Primary Healthcare Development Agency. For all these reasons I've mentioned. But yet, if you go to the high-income countries, it's available. Even the boys are getting it now. So this is one of the moral inequities of vaccination that we're seeing with COVID now, that has been in existence with the HPV vaccine. And we as advocates have been fighting to introduce the vaccine into the low-income countries in Africa, where the burden of cervical cancer is actually highest. So when we talk about solutions, We talk about our governments, by which you mean our own immediate government. We talk about provision of infrastructure. We talk about awareness. But there's also the moral obligation of the big pharmaceutical companies of the Western world to provide access to things like this vaccine, like the HPV vaccine, like the COVID vaccine. I'm sure you know that there is no COVID vaccine available in Nigeria yet. But if I go to Dubai today, I can get it. I can pay and I can get a vaccine for myself. And we've seen some of our leaders doing that. And it's wrong. It's a moral inequity and we need to stop it.
All right, well, let's wind down now. Senator, on the lighter note, you didn't tell us that boys should get this vaccine, actually. But, well, at least now we know. But tell us, in the short term or long term, Senator, what would you like to see us achieve moving forward as we wind down?
Well, the cheaper intervention that we can afford in Nigeria is that of the screening and also in terms of promoting research in our institutions to even develop our own vaccines. So at least those basic things that can reduce the number of Nigerians that are coming down with cervical cancer, we can afford that at our primary health centers. So again, if we can strengthen our primary health center system and ensure that more people, they go out there to learn about how they can prevent cervical cancer, I think that is what is a low-hanging fruit for the country at the moment.
All right, Senator Lanre Tejosho, CCFN Campaign Global Ambassador and the chair of the Legislative Initiative for Sustainable Development, as well as Dr. Zainab Shinkafi Bagudu, First Lady of Kebbi State. She's also a CCFN Campaign Global Ambassador and the founder and CEO of Medicaid Cancer Foundation. Thank you both and all the best.
Thank you for having us.